Tooth bleaching or whitening is the process of lightening the color of the human teeth. Welcome to the part 2 of tooth bleaching lecture. I have already discussed types of stains, indications and contraindications of bleaching and mechanism of action of bleaching in part 1 lecture. Now in bleaching lecture part 2 I am going to discuss types and techniques of bleaching. What are the alternatives to bleaching? Safety factors related to bleaching and the technique for the tetracycline stained teeth. So there are two types of dental bleaching. One is vital bleaching and another is the non-vital bleaching. So vital bleaching is further divided into three types, one of which is the in-office bleaching. In this type, 35% hydrogen peroxide solution is placed directly on the teeth. It is important that soft tissues must be well protected. In-office bleaching technique may require more than one visits. It is important to re-evaluate the effect of in-office bleaching using rubber dam after 1 to 2 weeks to allow rehydration of the teeth to a stable shade. So the technique for in-office bleaching is divided into following steps that we have to take. First of all, we do clinical examination, shade selection, setup for bleaching, gingival barrier, rubber dam application, application of bleaching material, and the application of desensitizing agent. So vital bleaching is further classified as laser or light assisted in-office bleaching. So in this technique, dental lasers and high intensity light have been advocated. They provide powerful energy source to enhance the action of hydrogen peroxide. By rapid releasing the bleaching agent. The lasers which are used are the argon or carbon dioxide. Okay, so the third technique for the vital tooth bleaching is dentist supervised at home technique. In this technique, 10% carbamide peroxide is used. So hydrogen peroxide is used in low concentration. Also sodium perborate is used. For dentist supervised at home technique, we first of all take dental and medical history. Then we do clinical examination. Then dentists have to take impression for tray fabrication. Then tray is fabricated. Insertion of the tray, and we have to advise the patient for the recall visits to assess the progress and compliance. Now let's talk about the second type of tooth bleaching, which is the non-vital bleaching. It is divided into thermocatalytic technique, in which 30% hydrogen peroxide is applied to the pulp chamber. Then we have to apply heat for the 30 minutes to activate the solution in the pulp chamber. After that, solution is rinsed from the chamber. Another technique is the walking bleaching technique. In this technique, 30% hydrogen peroxide and Sodium perborate is used in paste form. Then paste is seated into the pulp chamber to permit activation of solution over several days. After that, use of sodium perborate or 10% carbamide peroxide alone is done. Now let's discuss about the alternatives to bleaching. If a patient doesn't want bleaching to the tooth and still wants that their teeth should be white, then what are the alternative options aside from the bleaching? So these include direct, composite, veneering, porcelain laminate veneer, microabrasion, and the macroabrasion. So the microabrasion is a process in which tooth surface is subjected to a combination of acid or abrasive. It is indicated in superficial stain. The acid removes mineral content, leaving the outer 22 to 27 micron of weakened surface that the abrasive removes quickly, hence a stained out surface of tooth is removed. For the microabrasion, abrasive is suspended in a water-soluble gel containing low concentration of hydrochloric acid. It is applied with a rubber cup for 20 to 30 seconds to the enamel. After that, enamel microabrasion system is available, which is Prima. And the macroabrasion is a process which is achieved by applying fine diamond or carbide finishing bar to the enamel at relatively low speed and very light pressure. It is only indicated for the superficial staining. The safety factors which are related to bleaching are the tooth and pulpal problems, soft tissue response, systemic effects, and the effects on the restoration. So now let's move towards the technique for the tetracycline stent teeth. The normal bleaching time for the tetracycline stent teeth is about 2 to 4 weeks. But some stent teeth can also take about 2 to 12 months of daily treatment. It is important to assess the sensitivity of tooth and the location of stain area, because the teeth which are heavily stained in gingival third area have poor prognosis. And that's the end of the tooth bleaching lecture part 2. The link of part 1 will be in the description. If you guys have any questions regarding tooth bleaching, leave the question in the comment section. And don't forget to subscribe Smart K3 Dentistry for more dentistry related videos like these. Also don't forget to follow me on Facebook and Instagram at Smart K3 Dentistry. Thank you guys for watching. See you in the next video.